Welcome to my show. A guest here. His name is Dale Block. Mr. Dale, how are you doing, sir?
I am well today. How are you?
I'm fine. Thank you very much. And also, thank you so much for the time and the opportunity, Mr. Dale. Firstly, you are an author. You are also a board certified physician. Can you please, Mr. Dale, discuss more about yourself and how you are doing currently now, Mr. Dale?
Well, I practice family medicine in several different locations around the United States for a little over 4 decades. During that time, I also did a lot of healthcare executive work, which is really on the administrative side of medicine. My big push is to help educate and lead the next generation of healers and leaders so that we actually can continue to have a robust, certainly American medical delivery system. But I also recently wrote about maintaining our global medical delivery system as well. So my big overarching is to take all that knowledge I acquired over years of practice and administration and continue to pay back as a kind of a shining star for those that are wondering whether or not they should even get involved.
Totally agree. In this life, the younger ones are the leaders of tomorrow. And what our elder ones know today, we need to learn from them so we can pass it on to the younger ones that are coming in the coming future. So it is 100% necessary for one to get the young people to understand these little things that are needed so they can also make it more better in the coming future. And that is why I also like to dive to your book, Nature Based Solution for Health Care. Can you please, Mr. Dale, discuss more on that book? And do you also have more books you are planning to write in the coming future, Mr. Dale?
Well, I have published my memoir this past February called My Son the Doctor: The Trials and Tribulations of a Modern Day Jewish Physician. We've had phenomenal feedback on that and very, very positive professional reviews. Other books that I just recently published, In the Pursuit of Real Science in a Modern Day Society, which really looks at scientific inquiry today and hopefully helps dispel some of the misunderstandings of real science. I also have another book published at the same time this spring called Healthcare Stewardship, which really looks at how do we use our healthcare resources that are limited today, and how best do we track that so that we have sustainability, and that is making sure that we've got the next generations set up to have a successful healthcare delivery system. We talked about the nature-based, and then I also published a book as well called Conservation Medicine, and it's a multidisciplinary approach to global biodiversity. So I actually have three books that I have put together that are really focused on sustainability in the future of global healthcare delivery.
100%. I also definitely went directly to your site and saw every one of the book. It is very, very beautiful. It has the real insights when it comes to the future because we are in the present and we have to know how we can work on the future to make things more better, not even more worse. And these are things that you are doing, which I'm really, really glad that is happening. And also, I would like to dive to the point, nature-based solution. When people hear nature-based solution, they will want to think, what is the meaning of nature-based solution? So for those that are new to the term, what do you think exactly a nature-based solution? And how do you think they also differ from traditional environment or also health interventions, Mr. Dale?
Well, I think the best way, or at least the most well-defined way of nature-based solutions is from the World Bank Group. And I'll actually read the quote. Actions that protect, sustainably manage, and restore natural or modified ecosystems to address societal challenges like climate change, food and water security, and disaster risk reduction, while at the same time providing human well-being and biodiversity benefits. Essentially, nature-based solutions leverages the power of nature to solve human problems in a way that also benefits the environment. So we're seeing a shift, right? And I think that's really kind of the major paradigm of moving away from the fact that healthcare is isolated from the natural world and recognizing that human health actually is tied to planetary health, and that interconnection is really important to understand what's happening right now, where we see escalating existential climate-driven health threats with rising temperatures, floods, other natural disasters. Believe it or not, healthcare itself is a major contributor to greenhouse gases, somewhere in the range of about 4 to 5% total greenhouse gas emissions globally. And I think that's a really important thing to remember as we talk about how do we get away from that or how do we improve it. Environmental stewardship and sustainability, those are foundational to essential public health functions. So, not only traditional clinical medicine, but also the essential public health functions and services that are so necessary in an integrated system of health. We're talking about hospitals and health systems redesigning themselves to be healing ecosystems. And we'll touch on that probably a little bit later. But I think nature-based solutions, to kind of sum up the question, reframes the role of healthcare from being primarily reactive to a very aggressive, proactive, regenerative state where we're helping people, place, and planet become more integrated and nature-centered in strategies for today and for tomorrow.
100% beautiful. That shows that nature is very, very valuable in our time. And that is the issue we are having in our time currently. During our old time, it is really different from our time now. A lot of climates have changed, a lot of things have changed, and that is how we have to project the future. We have to check what will benefit us as human. And nature-based solutions are the ways we could come together and see how the solutions can come in, and also give those knowledge to people who are coming, so things will be more better, so we won't have a world whereby things are just more worse and worse and worse. It's like we're just digging our own grave, and we do not want that. So thank you so much for those beautiful insights. And I also like to know, regarding the definition you brought to the point of nature-based solutions, there are also schools, healthcare, and also workplaces that this can also be integrated as well. So, are there ways that you think schools, healthcare, setting, or workplace can also integrate these nature-based strategies into their infrastructure, Mr. Dale?
That's a great question. And so let me help everybody kind of focus on two things. One is I'm very evidence-based driven. So things that I write about and talk about have to have some proof in the literature that they actually either work or they don't work. But what's really kind of cool about nature-based solutions is there's actually two um, solutions that are very well researched. The evidence is overwhelming that we should really be thinking about that connection between nature-based solutions and healthcare outcomes. So the first is hospital gardens. Believe it or not, many hospitals around the world actually do keep their grounds very well manicured, if you will. And we know that when patients see those grounds, either from being at a window looking out or actually going out at times into the environment, there's a significant decrease in stress and anxiety. And what does that mean? Well, if you've had surgery, fewer post-surgical complications. And last but not least, these green spaces really do support rehabilitation because they encourage light physical activity, cognitive engagement. They're really there to kind of help facilitate the healing process, whether it's from a chronic illness or whether it's post-surgical. The other area that is really well established in the literature as being successful is urban green infrastructure. So we know that in neighborhoods, and certainly those neighborhoods that actually try to increase the greenness of their neighborhood, we see lower rates of violence and crime. We've got safer, more walkable environments, and it supports, physical activity and other types of health promotion activities that really kind of improve wellness and well-being. Another really good example is New York City has really tried to increase their urban forestry. And what that means is by bringing in, more trees, we actually see an improvement in air quality. We see a reduction in exposure to pollutants that drive those chronic conditions like respiratory issues, asthma, and the like. Nature-based solutions are really there to help move upstream and deal with the root causes of what chronic conditions are. I'm not sure that your listeners are familiar with this, but we know today that your zip code, certainly that's what we call, basic neighborhoods in the United States, right? Determines your health status more than your genetic code. So what does that mean? It means that we're not paying attention enough to the surroundings of where people live. And I know we'll get into talking a little bit about vulnerable and marginalized communities a little bit later in our chat. But we know that if we can get nature-based solutions established, that they will provide a therapeutic environment over and above what people are dealing with from a rising temperature, local pollution, unhealthy water, to really transform, the built and clinical environments into that what I call the healing ecosystem. So there's a lot of good research out there, and part of developing the book Nature-Based Solutions in Healthcare uh, had to do with identifying those evidence-based ways of improving on health and moving upstream and recognizing, the social health-related social needs, economic determinants, environmental determinants, and such to move forward in healthcare delivery? That's a great question.
It shows that there are a lot of things we need to do in our community, in those workplaces, in those healthcare infrastructures. There are a lot we need to do that will help us naturally. There are a lot of things we need to put in place so that we can have more better healing within we humans. Because the more, sometimes the more this technology, the more these things that are rising, the more we have this issue with health. During the last 20 years, we do not have phones and stuff that are affecting our vision and stuff like that. There are still more of engagement and stuff like that, but now it is different. People are using devices, things like that, and it changes the way the health works. And that is why we need these nature-based solutions around us. And that is why I also like to know the people that need it the most. And that is very important. Everywhere can be green, but there will definitely be some people that will need this thing the most. And that is why I would like to dive to Mr. Dale. How do you think we can also ensure that these solutions don't just go green and just normal, wealthy areas, but brings healing and restoration to the communities that actually need it the most, Mr. Dale?
So now we're talking about what I would describe as health equity. Um, and I think that to really serve the underserved or climate vulnerable communities, we really have to focus on equitable, participatory, and justice-centered approaches. So collective impact, social justice leads to social change. And we need to, whether we're a government entity, whether we're a private entity, we have to improve the overall health and well-being of everyone if we're going to be successful in certainly addressing the Anthropocene climate change, right? So how do we do that in communities that maybe are really struggling and are probably more marginalized and vulnerable? Well, community-based organizations need to step up and really connect with their communities to use the nature-based solutions and help educate. So we would see an improvement in what I call health education and literacy. The other thing that is important is, again, and I go back to this because it is so important, we have to recognize that health related social needs and other determinants of health, those upstream factors, have got to be addressed and corrected if we're going to see any downstream improvement in healthcare outcomes, right? So that's the other thing. Building equity into all planning. You have to be thinking about it to do it. And if we build it into how we design and then implement nature-based solutions, that is another way that we can make sure that the most vulnerable, the most marginalized are going to benefit just as much as those that are on the other side where they have the wealth and ability to be green. I think too that you can't just plant trees in poor neighborhoods and go, "Yep, we're doing it. We're solving the problem." It's much more than that. And restoring engagement and empowerment, access, and actually opportunity through nature itself is a means of doing representation, fairness, and belonging. Three words that I'm using instead of diversity, equity, and inclusion, to avoid the negative, feelings that people have now towards those three words. We can call it whatever it is, but if we don't address everything for everybody, I don't think we'll be very successful in maintaining healthcare delivery from a global perspective. Another really good question.
Thank you so much for the insight, Mr. Dale. We have to try our best to know how we could address a lot of things. There are little things that that needs to be checked on. When we check on those little things, then we will know the right people that needs it the most. We will know the right areas and the right place we need to make greener so we could have a life that every single person are living more healthy life. We need it and it is very necessary in our time today to be 100% honest. And also I want to go back to we people that could be listening. What role do you believe that local government NGOs and also listeners, people who are listening, can also play on their own role as humans in scaling nature-based efforts globally, Mr. Dale?
That's another really great question. And I guess I would talk about it as being advocates for change.
Mm.
So we talked a little bit about collective impact, social justice leads to social change. Well, if we're going to really make a difference, we have to follow that rule because the levers for change, especially from a healthcare perspective, they're about four. So we need to embed climate and nature literacy in both undergraduate medical education and graduate medical education around the world. We can also start even before that by helping in the pre-medical education or just secondary education, elementary schools, junior highs, high schools, that awareness. We have to build nature-based solutions into community health needs assessments. Now we're getting back again into public health and essential public health functions and services. Um, we talk about public policy or public health policy. I talk more about healthy public policy, and there's a big difference. Public health policy really looks at, again, essential public health functions and services. But what healthy public policy focuses on are those upstream determinants of health that we've been talking about, and how you would use nature-based solutions to support that. And then finally, we need to support community-led nature-based solutions because it helps with developing the trust, the transparency, the truthfulness, and long-term sustainability that is really necessary for for levers of change if we're going to really have an impact. And I think those 4 points are probably the most important. But again, we've talked about the importance of collective impact, social justice, and social change. And I talk about that in my book, Nature-Based Solutions for Healthcare, because it addresses, again, the human-induced, man-made climate change problems that we've been talking about in our conversation today, but everyone's talking about in conversations all around the world.
Which shows that we as people can also contribute and be an advocate to make a change through nature-based solutions, which is something we need, and we have to try our best as humans to be an advocate, to work on things that will better our health. It's for the best of every single one of us. If we do it, the next generation and generations will enjoy what we've done, and that is a valuable place one can advocate for, which is so beautiful. Thanks so much for the insights. I would like to go back to your book, Nature Based Solutions for Healthcare. If listeners could just remember one message from your book, Mr. Dale, what do you think it will be about the future health, healing, and also the natural world as a whole, Mr. Dale?
One thing that I think the listeners can do is be intentional when they are out in the natural world. If there's one thing that they could do is when going out for a walk in nature, be more intentional and observant about what's happening. If we simply just go for a walk, yeah, it's great for physical activity, it's great for health promotion. But if we're not intentional in our thinking and our observing that this may be a way for us to help nature-based solutions in the healthcare sphere, um, we're essentially just kind of missing an opportunity that's really right out in front of us. And those are the kinds of things then that lead to other activities that are more intentional in understanding the environment around us. And we have to teach the next generations to do the same. I don't think it's too late. I think there's a lot of discussion that we've already fallen off the cliff, and we're simply just watching the demise of the global environment. But I don't necessarily agree with that. I think that there's an opportunity for the global environment to continue to change. And if we do these things from an individual perspective, from a community perspective, from the healthcare stakeholder perspective, we are going to improve the environment. There is no doubt about it. And if I didn't think that, I certainly wouldn't write books on sustainability and global healthcare, to share with others kind of a roadmap of what do you need to do. And hopefully it brings out the consciousness of intentionality, which is kind of, like I said, how I started off the answer to the question. But I think if there's one message, and I know we're coming up on time, and I want to share this with the listeners, I wrote this down, and I'm going to read it because it's so it hits into the core of really what we've been talking about in nature-based solutions. Nature is not a luxury. It is to be respected and
Yeah.
cherished as a national treasure. It is medicine, infrastructure, and justice. When healthcare workers treat it that way, they help shape a future where well being is rooted in people, place, and the planet. Those of the listeners today, play that back a few times. Listen to this conversation a few times because it's so important if we are going to make a difference in the world. But I wanted to give that final thought because I think it is so meaningful, and really strikes at certainly my core, right in my heart, that I still believe that we can make a difference. We just have to keep trying. We got to keep trying harder.
Mm. Honestly speaking, as I said, there are a lot we need to do in our heads. There are a lot of things that we are seeing currently now. If we could try our best to work on a lot of things, and that is why I love what you said earlier. We need to be observant of what we have around us. Exercise is great, but we need to also check on things, see things, and we'll see a lot of valuable things we could bring up to work on to make things better naturally. We should respect nature. And that is the issue we're having our time today, Mr. Dale. You know, you and I will agree that many people are not really connected to nature. Probably, maybe that is why people do not really respect it. And it is a very huge issue for us because by the time the problem starts, floods, everything, we will not be able to, carry it anymore longer. We need to try our best to respect nature. When we respect nature, we know how to be an advocate for it, work on it to become more better so that we can have a better future for the younger generations who are coming. Not that we will do something that younger generations who are coming will suffer for. We should do something that they will enjoy and carry on to make it more better. Nature is important, and I'm so glad that we had this conversation because it's a very, very important one, to be honest, Mr. Dale. Lastly, Mr. Dale, there is a question I normally ask during the end of the show. From our forefathers, from our ancestors, there are a lot of things that do exist during our ancestral time that is missing in our time today. If there is anyone or anything you would like to bring back to our time today, Mr. Dale, what do you think that thing would be, Mr. Dale?
Wow. That's a kind of an overwhelming question to think about, right? But I think if we if we use, say, nature-based solutions as kind of that everyday advocacy grounded in nature, I think we can certainly start by greening the workspace. That improves physical, mental, and social health for all. Tell compelling stories. Build the trust and momentum wherever you live in the world to move in that direction. Partner with your local community-based organizations. There are so many different groups that are trying to improve the environment. Get involved. Find one that you can get involved with and work on it. Um, we need to teach the next generation. Our generation, my generation, has made significant mistakes
Yeah.
that the next generation is trying to fix. And if we have this attitude that we want to pay things forward, we can help that next generation get boosted up, stronger, empowered to make those changes. And last but not least is we really do need to speak up in public, and we also need that healthy public policy. That's what shapes systems thinking for a sustainable impact. Otherwise, again, it's all words. I would not have written the book Nature-Based Solutions in Healthcare if I didn't think these things. I would love to come back and chat about my other books that are focused on sustainability, healthcare stewardship, and conservation medicine in the near future, because I think it's the what you're doing, Terry, is so important, is getting this information out, being in that consciousness. If we don't make it part of our consciousness, we're not going to see improvement. So I thank you for having me on your podcast today to talk about these issues. And we are not done talking about them. We've got so much more that we can cover that I think we would have some exciting impacts that people, I think, would recognize as part of that consciousness by continuously talking about it, bringing it to them, using your podcast to educate and lead. It's just so important. So thank you again for having me today. It's been just a wonderful experience and a great conversation.
It's my pleasure. It means a lot to me, and I honestly thank you for the time and the opportunity. We have to try our best to give this kinds of information out to people so people will be aware about it so they could also try their best to see one or two things they can also do for the community. And 100% we could definitely have more conversation in the coming future regarding nature, regarding a lot of things that we need, because that is what my podcast is all about: healing and educating people to make people aware and know how they could also make things work in the community they find themselves and in the world they also find themselves. From the bottom of my heart, I also want to thank you also for the time and the opportunity for speaking on this very powerful information on nature-based solutions. Thank you so much, Mr. Dale.
Thank you for having me.
All right, Mr. Dale. Have a wonderful day, Mr. Dale. Bye bye.
Take care.
All right, sir.
We'll talk.